हेलो फ्रेंड्स, वेलकम ऑल ऑफ यू। आज का हमारा टॉपिक है नर्सिंग केयर प्लान ऑन अपेंडेक्टोमी और अपेंडिसाइटिस। मीन्स आज हम वीडियो में अपेंडेक्टोमी या अपेंडिसाइटिस का नर्सिंग केयर प्लान लर्न करेंगे। दिस इज़ वेरी इंपॉर्टेंट नर्सिंग केयर प्लान फॉर एग्जामिनेशन पर्पस एंड आल्सो प्रैक्टिकल फाइल वर्क पर्पस। तो आप वीडियो को ध्यान से देखिएगा एंड लर्न कीजिएगा एंड आप इसका अच्छे से इसमें सीखिएगा। तो आइए देखते हैं नर्सिंग केयर प्लान या एनसीपी ऑन अपेंडेक्टोमी या अपेंडिसाइटिस। ये नर्सिंग केयर प्लान ऑफ अपेंडिसाइटिस। सबसे पहले देखते हैं अपेंडिसाइटिस क्या होता है। अपेंडिसाइटिस ऑल्सो नोन एज एपिटाइफाइलाइटिस इज द इन्फ्लेमेशन ऑफ द अपेंडिक्स which is a small finger-like appendages attached to the cecum. Next, appendectomy. Here, appendectomy is the surgical removal of the appendix. And inflamed appendix may be removed using laparoscopic approach with laser. Here, हमने अपेंडिसाइटिस और अपेंडेक्टोमी के बारे में पढ़ा। नेक्स्ट देखते हैं हमारा जो मेन टॉपिक है नर्सिंग केयर प्लान ऑफ अपेंडिसाइटिस। तो नर्सिंग केयर प्लान में सबसे पहले हम यहाँ जो हमारा फर्स्ट स्टेप है नर्सिंग असेसमेंट वो देखते हैं। ये नर्सिंग असेसमेंट फॉर अपेंडिसाइटिस। Nursing assessment of a patient with appendicitis may be both objective and subjective. Here, assess the level of pain by asking the pain scale. Next, assess relevant laboratory findings. Next, assess patient vital signs in preparation for surgery. Next देखते हैं patient may report of abdominal pain, rebound tenderness, rigidity. Next, may exhibit facial grimaces, muscle guarding, distraction and behavior. Distraction behavior. Next, may exhibit excessive expressive behavior, restlessness, mourning, crying, vigilance, irritability, and sighing. Next, may exhibit tachycardia and tachypnea. And next, may report constipation and diarrhea. And may exhibit decreased or absent bowel sound. And may report anorexia, nausea, and vomiting. These are the defining characteristics after the nursing assessment of the patient with appendicitis और appendectomy जो हमने बाई ऑब्जेक्टिव एंड सब्जेक्टिव डाटा गैदर किया। तो आप यहाँ से एक बार फिर देख सकते हो और यहाँ पर अपने नोट्स तैयार कर सकते हो। नेक्स्ट देखते हैं नर्सिंग डायग्नोसिस फर्स्ट ईयर। जो हमारा टॉपिक है नर्सिंग केयर प्लान अपेंडिसाइटिस उसका यहाँ फर्स्ट नर्सिंग डायग्नोसिस। acute pain may be related to distension of the intestinal tissue by inflammation and presence of surgical incision. This is the first nursing diagnosis of this nursing care plan. After nursing assessment, we write this nursing diagnosis means patient को acute pain है related to distension of intestinal tissue एंड बाय इन्फ्लामेशन एंड प्रेजेंस ऑफ सर्जिकल इंसिजन। तो हमारा यहाँ डिजायर्ड आउटकम या गोल होगा रिपोर्ट पेन इज रिलीव्ड एंड कंट्रोल and appear relaxed, able to sleep and rest appropriately, and patient demonstrate use of relaxation skills and diversional activities as indicate for individual situations. This is our goal or desired outcome for this nursing diagnosis here. नेक्स्ट देखते हैं इस नर्सिंग डायग्नोसिस का इंटरवेंशन एंड रेशनल एंड एवेल्यूशन। Here nursing intervention for this first diagnosis. Here and rational. Here, first intervention, assess pain, noting location, characteristics, severity, that is on pain scale 0 to 10 scale. This is pain scale type, and investigates and report change in pain as appropriate. तो ये हमारा फर्स्ट नर्सिंग इंटरवेंशन है, मीन्स हमको असेस करना है पेन स्केल पर पेन का लोकेशन, सीवियरिटी एंड इन्वेस्टिगेट द एनी चेंजेस इन पेन अप्रोप्रिएटली. नेक्स्ट इसका रेशनल होगा useful in monitoring the effect of medication, progress of healing, changes in characteristics of pain, indicate developing abscess or peritonitis requiring prompt medical and intervention. This is rational for this first intervention. Next देखते हैं second intervention here. Provide accurate honest information to patient. Means हमको पेशेंट को सारा इन्फॉर्मेशन करेक्टली बताना है. मीन्स इसका रेशनल होगा विंग इन्फॉर्म अबाउट प्रोग्रेस ऑफ सिचुएशन, प्रोवाइड्स इमोशनल सपोर्ट हेल्पिंग टू डिक्रीज एंजाइटी. नेक्स्ट थर्ड intervention, keep at rest in same fowler's position. Here intervention to lessen the pain, gravity localizes inflammatory exudate into lower abdomen or pelvis. Next fourth, encourage early ambulation, that rationalize stimulate peristalsis and passing of flatus, reducing abdominal discomfort. Here next intervention, provide diversional activities. Here rationalize refocus attention, promote relaxation and may enhance coping abilities. मीन्स डाइवर्सनल थेरेपीज जो पेशेंट के मूड को डाइवर्ट करे उसके लिए हम इसको देते हैं. सिक्स इंटरवेंशन, कीप एनपीओ एंड मेंटेन एनजी सक्शन इनिशियली. ए rationalize decreases discomfort for of early intestinal peristalsis, gastric irritation and vomiting. Next intervention here, administer analgesics as indicated, rational to relieve pain. Next, place ice bag on abdomen periodically during initial 24 to 48 hours as appropriate. A rational is soothe and relieve pain through desensitization of nerve ending by ice pack using. Next intervention here, never apply heat to right lower abdomen. Here rational is this may cause the appendix to rupture. मीन्स हमको हीट एप्लीकेशन यूज़ नहीं करना है जिसके कारण अपेंडिक्स रप्चर हो सकता है. तो ये था इंटरवेंशंस फॉर दिस नर्सिंग डायग्नोसिस ऑफ acute pain. To continue, your intervention number 10, watch closely for possible surgical complication. A rational is continue pain and nerve may signal and abscess. Means these are nursing interventions for this nursing diagnosis acute pain. After providing these interventions, that is here 10 interventions we provide to patient. After this we evaluate the patient for our goal is achieved or not. Here now pain is relieved and patient appear relaxed. This is first nursing diagnosis of this care plan is complete. Next देखते हैं nursing diagnosis number second. here nursing diagnosis second year, risk for deficient fluid volume related to preoperative vomiting, postoperative restrictions, example NPO nil or orally. This is second diagnosis, means risk for fluid volume deficit. Here desired outcome and goal of this diagnosis, the client will maintain adequate fluid balance as evidenced by mucous membrane, good skin turgor, stable vital sign and individually adequate urinary output. This is our goal or desired outcome for this diagnosis. मीन्स क्लाइंट्स का जो फ्लूइड वॉल्यूम है वो ठीक से हो, मेंटेन हो, जिसको हम चेक कर सकते हैं बाय म्यूकस मेम्ब्रेन, गुड स्किन टर्गर, वाइटल साइन. तो आइए देखते हैं नेक्स्ट इंटरवेंशन फॉर दिस नर्सिंग डायग्नोसिस एंड देयर रेशनल एयर. Here first intervention, monitor BP and pulse variations help identify intravascular volume. Next, second, inspect mucous membrane, assess skin turgor and capillary refill. Here, rational for this indicators of adequacy of peripheral circulation and cellular hydration. Next, third intervention, monitor intake and output. Note urine color and concentration specific gravity. Here, decreasing output of concentrated urine with increased specific gravity suggests dehydration. Means हमको ये this is very important intervention to know the fluid volume deficit condition. Next intervention देखते हैं number 4. Intervention for risk for fluid volume deficit continue. After 3 intervention, next 4 intervention is auscultate and document vowel sound. Irrational is indicators of return of peristalsis readiness to begin oral intake. Means after intestinal sound come or peristalsis return, we start the oral diet to the patient. Next intervention here, provide clear liquid in a small amount when oral intake is resumed and progress diets as tolerated. Here and rational is reduce risk of gastric irritation and vomiting to minimize fluid loss. Next intervention here, number 6, give frequent mouth care here. Give frequent mouth care with special attention to protection of lips. Here, dehydration results in drying and painful cracking of the lips. Next, maintain gastric and intestinal suction as indicated here. Rationalize as angio tube may be inserted preoperatively and maintain in immediate postoperative phase to decompress the bowel, promote intestinal rest and prevent vomiting. Next intervention, administer IV fluids and electrolyte to treat dehydration, relative electrolyte imbalance. Here next intervention number 9. Never administer cathartics or enemas. Here cathartics and enemas may rupture the appendix, मीन्स ये appendix cause कर सकते हैं. Next appendix rupture कर सकते हैं, sorry. Next number 10 intervention, give the patient nothing by mouth and administer analgesic judicially. Here this make mask symptoms. Means next after providing these interventions we reach or write the here evaluation for this nursing diagnosis. Here evaluation is adequate fluid balance maintained as our goal is achieved by these interventions. Next देखते हैं nursing diagnosis. Nursing diagnosis number 3, risk for infection related to perforation rupture of the appendix, peritonitis, abscess formation and invasive procedure surgical incision. Here desired outcome or goal is achieve timely wound healing free of sign, infection, inflammation, purulent drainage, erythema and fever. This is our goal for this nursing diagnosis. Next देखते हैं intervention for this. Here intervention first, practice and instruct in good or hand washing and aseptic wound care, encourage and provide perennial care. Here rational is reduce risk of spread of bacteria. Next second intervention here, inspect incision and dressing, note characteristics of drainage from wound if inserted presence of erythema. Here rational, provide for early detection of developing infectious process and monitors resolution of pre-existing peritonitis. Next third intervention for this diagnosis. Here third intervention, monitor vital sign, note onset of fever, chills, diaphoresis, changes in medication, changes in mentation, report of increasing abdominal pain. Next here suggestive of presence of infection or developing sepsis, abscess, peritonitis. Next, obtain drainage specimen if indicated here. Gram stain culture and sensitivity testing is useful in identifying causative organism and choices of therapy. नेक्स्ट देखते हैं नंबर 5th intervention administer antibiotics as prescribed. Rationally, antibiotics given before appendectomy are primarily for prophylaxis of bone infection. Next intervention prepare and assist with incision and drainage as if indicated here may be necessary to drain contents of localized abscess. Next intervention watch closely for possible surgical complication. Irrationally, continuing pain and fear may signal an abscess. After providing these interventions, we write here the evaluation, the last step of nursing process here. Our evaluation for this diagnosis here. Achieved timely bone healing, no sign of infection and inflammation. That's our goal is achieved by checking this evaluation process. Next diagnosis देखते हैं हम. Nursing diagnosis number 4. Deficient knowledge may be related to information misinterpretation and unfamiliar with information resources. A desired outcome verbalize understanding of disease process and potential complication and therapeutic needs, participate in treatment regimens. For this nursing diagnosis, we write here next step nursing intervention. Here first intervention identify symptoms requiring medical evaluation, increasing pain, edema, erythema of bone, presence of drainage fever. Rational is prompt intervention, reduce risk of serious complication, delayed bone healing, peritonitis. Next intervention, review post-operative activity restrictions, heavy lifting, exercise, sex, sports, driving. Irrational is provide information for patient to plan to for return to usual routines without untoward incidents. Next देखते हैं intervention number 3rd, encourage progress activity as tolerated with periodic rest period. Intervention rational prevents fatigue, promote healing and feeling of well-being and facilitate resumption of normal activity. Next intervention number 4th, recommends use of mild laxatives or stool softeners as necessary and avoidance of enemas. Here rational for this intervention assist with return to usual bowel function, prevents undue straining for defecation. Next intervention number 5th, discuss care of incision including dressing changes, bathing restrictions and return to physician for suture and staple removal. Here intervention for this understand promotes cooperation with therapeutic regimen, enhance healing and recovery. Next intervention here encourage the patient to cough, breathe deeply and turn frequently. Here intervention prevent pulmonary complication. Here next evaluation here for after providing these interventions we write a evaluation, the verbalized understanding of disease process and potential complication and participate in treatment regimens. Means here our goal is achieved by this evaluation process. तो फ्रेंड्स ये था हमारा आज का टॉपिक नर्सिंग केयर प्लान ऑन अपेंडिसाइटिस एंड अपेंडेक्टोमी. तो आपको दोनों कंडीशंस में यदि एग्जामिनेशन में अपेंडेक्टोमी आए तो भी यही नर्सिंग डायग्नोसिस लिखना है एंड अपेंडिसाइटिस के लिए भी यही नर्सिंग डायग्नोसिस लिखना है इन नर्सिंग केयर प्लान. तो फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपनी लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस नर्सिंग केयर प्लान वीडियो विद योर फ्रेंड्स and subscribe my YouTube channel Anand Nursing File. Here we provide different nursing related matter like nursing care plan, case study, community health nursing in family folder format, and also here we provide the nursing preparation examination questions and image based question, nurses dictionary, medic term, nursing foundation, and many other nursing subject notes here. फ्रेंड्स चैनल को प्लीज़ सब्सक्राइब कीजिएगा देन बेल आइकॉन और प्रेस। थैंक यू।